If today you walk to our hospitals, 58% of total pediatric admissions, those children who are admitted in hospitals, you will realize that 58% of them are calcium-related issues. Gone are the days when fish was available everywhere. You know, sometimes back when we were growing up, maybe even some
Is it
even
why
today.
we used to give, even as we used to give children emulsion
Yes.
and cod liver oil?
Yeah.
Oh,
And the
okay.
7 C's.
Yeah.
Very important. It is to make sure that their immune system is strong enough to combat the environmental diseases, infections, all that. GMO. They genetically engineer your food, and there's nothing you can do about it. And
So that
it
one
is in
is
good
just
faith.
increasing the production.
The food basket. But
Wow.
nutritional value, nothing. For example, before those people who were in the 70s and 60s, one orange a day would keep the doctor away. They had enough vitamin C. As we speak today, you need 30 pieces, medium-sized oranges, to get the equivalent of vitamin C that you need per day. The accumulation of toxins in your gut. If you do not help the body to detoxify, the root cause of many other issues will come from that area. Okay, there is a way you should detoxify at least 2 to 3 times a year so that your gut does not accumulate that waste.
Hello viewers and welcome to Lucemoria Network. Again, I told you we are changing lives. We are talking, giving information, educating and inspiring people. I told you we'll be interviewing different stakeholders on the issues affecting our older persons in this country and around the globe. And today I have the opportunity of meeting Dr. Peter Mungai, which is going to talk about himself and tell us who he is. He is having very interesting topics, like even myself as a nurse, I never had before, but he's well schooled, well educated. So we have the opportunity of learning from him. With that, please help me welcome Dr. Peter Mungai.
My name is Dr. Peter Mungai. I'm a surgeon by profession, having gone to Harvard University. And I also practiced in the US for some time, and also Canada. And as a surgeon, I met various cases that really needed a lot of intervention from the surgery side. But I also realized that in the course of practice, most of the diseases that can cause fatalities actually do not really need any intervention from the surgery side. These are lifestyle diseases, metabolic diseases, and of course those that are so deep, like cardiovascular disorders. We have talked about cancers. Those are some of the areas that really took the world by surprise, and that is what led me to go back to class. And I went back to Seattle, and I went to John Betray School of Naturopathic Medicine to took a degree in Naturopathic Medicine, which entails proactive measures, like what is the most preventative way, how seriously do you take your health, and what budget do you put aside for your health before you come to sickness. And if you are in that category that you call yourself sick, then, or you are already declared a patient with no diagnosis, then what measures, or do you take any form of supplement to counterattack the side effects of the good medication you'll be taking? That said and done, I profiled the numbers in the world, and I saw cardiovascular disorders are number 1 all over the world. We come to cancers, they are number 2. And those by themselves, you realize they are non-communicable and very silent, but causing a lot of fatalities around the globe. And if you come to the third one, it is medical error. Medical error all over the world is known to cause, it is the third leading cause of death out of the possible 5,000. And of course, side effects of good medication or overreaction of good medication at number 4. So having considered those 4, I really wanted to concentrate on how can somebody take maybe their health as their personal responsibility. That is how I ended up doing naturopathic medicine, and that is what I practice for now.
Wow, naturopathic medicine. It's huge. But you know, you went to Harvard, eh?
Yeah.
So a lot of us might be hearing that for the first time.
Sure.
And maybe even some things, you know, when we were in high school, Daktari,
Yes.
we used to, even the handwriting which you could not read, you say you're writing like a doctor.
Yeah.
Now for a regular viewer, cardiovascular. So some of the words you might be giving a pause so that we can explain to the viewers.
Sure.
So for example, what is cardiovascular?
Cardiovascular disorders are diseases that affect the heart itself, the blood vessels, and the blood itself.
So cardiovascular is the heart.
The heart,
diseases.
the blood vessels, and the blood itself, like hypertension, heart failure, cardiac arrest, cardiomegaly. All those are diseases that will be affecting the heart itself. Cardiomegaly is the enlargement of the heart. There will be those that can stop the heart suddenly, like cardiac arrest, that will affect the heart. There will be hypertension, or HTN, which will be high blood pressure. It affects the blood vessels, okay? And there are those that will affect the blood itself, like iron deficiency. All those are cardiovascular disorders. They are very silent killers. They come to somebody's life, live with you, and approximately now 70% of the people who die of hypertension or high blood pressure have no clue that they have it. Apparently, even 90% of the people with hypertension don't know they have it. They are not yet diagnosed.
Daktari, you practice in Canada, in the US.
Yes.
And in a new field, the naturopathic medication.
Yes.
And now you're back in the country. And maybe you realize also even Kenyans need to understand what is this. We are used to the functional medication and the regular, the generic medicines.
Yes.
And this is a very interesting topic.
Sure.
So now I would like you in details maybe to tell Kenyans what is this in naturopathic medication in a language that they can understand. Maybe some people maybe they even know, but when you use the big word, pathic medicine,
it becomes a little bit difficult.
But we understand you from Harvard.
Sure.
All right, doctor.
Naturopathic medicine naturally entails you as a person first taking your health as your personal responsibility. That is, number one, you should know that most of the diseases, 80% of diseases or conditions emerge from what you eat. Your digestive tract is the custodian of 70% of your immune system. The digestive tract or the digestive system entails from the mouth all the way, what goes in there, how it is digested, how it is assimilated, accounts for 70% of your immune system. Likewise, 80% of all the diseases you know of will originate from that gut.
Wow.
How well you are is defined by how the gut is. How you eat, what you eat, how it works for you is now the total you. You are the equivalent of what you eat.
So your health is defined by 70% by your gut. Your gut, that means from mouth?
From mouth all the
to
way
the stomach,
to the rectum,
to the intestines,
everything.
to...
Yes, and it's a huge system because approximately the small intestine is about 7 meters. That is about 23 feet. That's a long tube. Okay, anything that can affect that tube is enough to cause you a lot of problems. And it is unfortunate that now what we eat and what we should be eating is no longer in our hands. We are not the determinants of what we eat. It is determined by somebody else.
So what do we do, Doctor?
That is now what is naturopathic is all about.
So pathic is like from the path?
Yes, natural. Not naturally walking, naturopathic.
Oh, finding your way.
Finding your way to a good and healthy life. Now, you see, we are no longer in charge of what we eat. The food is determined how it will come to us by some farmer somewhere. If they decide to use chemicals on them, they have nothing we can do about it because they have to use the fertilizer anyway. If they use the herbicides, we don't have to do anything about it. If they use pesticides, they end up on our tables. Okay? So the body itself has a way of digesting the food if the food is very natural and eliminating that specific waste. But if it comes with other chemicals, heavy chemicals, like the fertilizers, what the body does is to just keep it in your system. It is not able to eliminate that waste. And the accumulation of that waste is the number one cause of all the other metabolic disorders.
Wow. Now that you talk about the side effects of fertilizer and all the other chemicals, Dr. what about GMO?
GMO, right from 1969, it has been around in Africa. And what it has done is to increase the food basket, but it has not dealt with the nutritional factor. So when somebody tells you, okay, I take a balanced diet every day, I watch what I eat, then the question is, what do you do about a GMO? They genetically engineer your food, and there's nothing you can do about it.
So that
it
one
is in good
just
faith.
Increasing the production.
The food basket, but nutritional value, nothing. For example, before those people who are in the 70s and 60s, one orange a day would keep the doctor away. They had enough vitamin C. As we speak today, you need 30 pieces, medium-sized oranges, to get the equivalent of vitamin C that you need per day.
Because that orange that we have is not original anymore.
It is not original anyway. It has been engineered to fit the climatic change, the soil erosion, and the seasons, which have changed, okay?
So, Dr. with the naturopathic medicine, do you think we can be salvaged?
Very, very. In fact, many are the patients who were down. And I have come across very many people who have had given up. But once you engage in naturopathic medicine, then it is a restoration process. You no longer intervene. Conventionally, you intervene. Like in surgery, you just intervene. You come in and intervene for the patient. If it is something to be removed, like the appendix, fibroids, and that is something that you do for the body. But when you go naturopathic, you go for the root cause
of what is causing
it. Like I have just mentioned about the accumulation of toxins in your gut. If you do not help the body to detoxify, the root cause of many other issues will come from that area. Okay, there is a way you should detoxify at least 2 to 3 times a year, so that your gut does not accumulate that waste.
So, Doctor, in regular language that's
Yes.
understandable by our viewers, what is a detoxify?
Detoxifying is helping the body remove all the waste from inside the intestines and the large intestine.
It is possible?
Very possible.
And you're saying you need to do that like 3 times a year?
Yes, you need to do that. So about 2 to 3 times a year is okay.
Do you have to be sick to do that?
You don't have to be sick. In fact, what I try to do in this practice is to help people and tell them some of the diseases you are waiting to come so that you can seek intervention will not even give you that opportunity. You have never heard of somebody who went to hospital because they had a cardiac arrest. Never. All you do is to get the cardiac arrest and head to the mortuary very fast. Some of the diseases will not give you that X-ray. And some of them, even when they come and there's that intervention, the quality of life drastically reduces. Okay, like somebody now who have hypertension and there's nothing they are doing that is naturopathic. All they are doing is to take the medication they are taking. Of course, they know. The patient and the doctor know that they are at risk of getting a stroke.
Wow.
They are at risk. That is why the physician will insist, do not stop this medication.
Oh, yeah.
Until you advise so. But mine is not to advise the patient to leave the medication, but now to sit back and ask yourself, the origin of this hypertension is idiopathic. Basically, nobody knows how it came, but we can see some factors, like how is your weight? How is your lifestyle? How often do you exercise? What do you eat? What is your eating habit? How often do you rest? What budget do you have for your health now that you are already hypertensive? Okay? If nothing is done and you just take the medication, the doctor and you know that very soon there will be other complications that will come due to hypertension.
So, Doc, when you talk about how expensive, how much have you saved for your health?
Yes.
And you know it is expensive. How expensive is the naturopathic medication?
It is the cheapest thing you can do for yourself. For example, you should always know that in a week you should have at least salads 4 times in a week. Salads, just the natural salads that you can have. Okay?
Salads of fruit salad or
Fruit
vegetable
salads
salad.
and vegetable salads,
But
they
you
are very
already
much
said
okay.
that the foods that we're eating, actually they have no food
Yes,
value.
they have food value, and by doing so, you are just making the body more alkaline. Exercising is very natural, okay? And when you talk of the budget, we are talking of the budget. How often do you take multivitamins? How often do you help your body detoxify? How often do you fill in your calcium deposits, or how do you help your body to accumulate enough calcium per time? And basically, how many times do you take your medical evaluation per year or after 2 years? Those are very naturopathic things.
So let's go to the starting point.
Yes.
Tell us how you detoxify, because I think that is where now that is cleaning yourself.
Yes.
Before you start taking care of yourself, you must now take out which is there.
Very
How
good.
do you do that?
Several ways. One, you need to take a product or a supplement, so to speak, that will help the body, a supplement that can percolate the waste and help the body move out all that waste. That is number one. Number two, you follow it up with bioenzymes, natural enzymes, okay? They're in
What
form of
is that?
supplements. Then there's a supplement you take. You take a supplement that has bioenzymes. They are already labeled somewhere. You'll see that they are bioenzymes. You first start
What's the work of bioenzymes in the
to
body?
help increase digestion of the semi-digested matter already accumulating in the gut, okay? Then from there, you should also give yourself enough probiotics. You can start by giving probiotics that are in the supplements, and then follow it up with other things like yogurt, kombucha tea, all that.
How long does that take for the effect to be noticed or felt?
In fact, in less than 21 days, you'll have noticed that it's no longer you. It's a new you all of a sudden.
So in less than 21 days, you have
Yes.
taken those supplements, you have taken the bioenzymes,
Yes.
you have now taken probiotics.
Yes.
In 21 days,
In 21 days.
you will have cleaned yourself.
Very well.
How much is that?
That
Because
will
it has to come with a cost.
Yeah, it is not less than 10,000. It's around 10,500. That's just 10,500. You can do that twice a year. It will help you a lot. It will be one of the best things that you will be experiencing, because your energy levels will change. You'll be able to control your weight. You'll be able now to know that 70% of your immunity is secured.
So where do you get those supplements, bioenzymes and probiotics, from chemists? Or
No. They are from health stores, the natural health stores. But mostly I prefer if we have a sitting with a patient, so that we can know where they are, the conditions they are battling already. Okay? And if they are not in any condition, we have just a one-on-one on how is your sub-health status. Because as I've mentioned, things like hypertension will never come and announce their presence. They just creep into somebody's life and claim their life without as much as showing any sign. Things like cancer will only be noticed when they are stage 3. Stage 2, stage 3, because that is when they'll show the signs, So basically, I prefer if I have a sitting with someone, so that we can see what need is there for us to maybe intervene.
So, Daktari, I'm here myself because my interest is the geriatric, the older persons. And actually, they are the ones who have all these cocktail of medication we are talking about.
Yes.
They are the ones, as you age, as you retire, as you hit 60 and above, is when you get hypertension, is when you get blood pressure, and diabetes, you get all these cardiovascular diseases that you are talking about.
Yes.
Now, I think from what I've listened from you, this is like a preventive measure more than a curative measure, or maybe a surgical measure, because you are a general surgeon.
Yeah.
So you decided, instead of cutting people their colon and throwing it away, you'd rather teach them how to do it.
Yes.
Would that be the reason?
Yeah, that is the
So
reason.
all these diseases now, if you are to talk to our older persons, their families, and maybe our government, because maybe it sounds even more cheaper, even the NHIF maybe could cover that.
Mostly the
How about
NHIF
that?
may not be able to cover.
Why not? If it is something which is helping, or we
Sure.
can talk to them, and maybe they could come with NHIF.
True.
Yeah, we are talking about now the health of our older persons in the
Yes.
country, which is becoming very, it's just like a pandemic.
True.
It's very, the biggest problem that we have is their health. Can you talk to them
Yes.
there and tell them, is from what time in their life do they start getting worried about the prevention of the other diseases? When should someone start on naturopathic medication?
As early as now. But now for the older people, you realize what they suffer from is metabolic syndromes. You'll get them with diabetes, you'll get them with arthritis, you'll get them with hypertension or high blood pressure, because as a human being ages, the internal side, or the gastric system, or the walls of the stomach and the intestines tend to thin, and therefore it complicates their digestion, number one. Number two, they are not able to assimilate what you already give them. So the food they eat, most of it goes to waste. It is not digested, it is not assimilated. So no matter how good the food is, it is not properly utilized. So when we talk of older people and maybe a disease like arthritis, we realize that people call it just arthritis, but you know, there are many types of arthritis, with the most common being rheumatoid arthritis, or swelling of the joints, inflammations, okay? And the other one, which is osteoporosis or osteoarthritis, whereby now they feel a lot of cold, okay? If now somebody is already in that situation, it simply means that their body have failed to assimilate the calcium they need. The calcium, the magnesium, the zinc, the selenium, these are people who should be supplemented. By all means, they should be supplemented so that their quality of life can change. They should be given bioenzymes so that whatever they eat will be digested, okay? And they also should now be targeted for now this naturopathic treatment, whereby we help them. Like now, in my case, when I get somebody who is critical, we take them to a facility somewhere. It's a naturopathic clinic, whereby we first take them through something called a juicing process, whereby we eliminate solid food and we give them a kind of a juice every half an hour. Cabbage juice, should it be carrot juice, should it be orange juice. Every half an hour they have something they are taking for 2-3 days, okay? So that now they can be able to assimilate as much as possible in matters vitamins. They can be able to get enough magnesium, calcium, all that. Then from there now we give them the supplements they need, okay? Because most of these people have taken a lot of medication over a period of time, and majorly when you take a lot of medication, that medication ends up as a heavy metal, and it's called a metabolite, and it is stored in the liver. And the liver is the food store of all the other kind of nutrients. All the nutrients you need in your body is stored in the liver. So if metabolites are also stored there, it means the metabolites start destroying other cells.
So, Doctor, are you trying to say with the symptoms, I don't know if it is symptoms, the pains from arthritis, can be curable?
Yeah, definitely, they can. They can. Once you establish that these are the pains, rather than keep on giving the painkillers and giving everything, we know that it's a deficient, it's a metabolic syndrome. It just didn't come. It came with a reason. It becomes worse as you age because the body is not able to maybe process vitamin D and all the other minerals that you need for proper bone structure. So the structure of the bone is interfered with.
It's not that you stopped taking vitamin B, but your body cannot process all the vitamins the way it used to.
You can't. Wow. The thinner it becomes, the less effective it is. Peristalsis is affected. Constipation will be with these old people. You know, most of the time they don't tell you about it until it becomes critical. But they start with the constipation. Okay, bloating, franchise, all these start accompanying. That tells you that we have an impaired metabolism. They are not digesting their food. So if you can be able to intervene from that direction, that they can be able now to avoid things like constipations, then you are already on your way to giving them something else that can help them now.
Now, naturopathic medication. So, did you say it can be used by anyone, not just the old people?
Yeah.
It's from which age are you? Is it advisable?
As young as a child starts eating, okay, from 6 months going forward, we need to address it as a crisis. Many are the people who just assume that you have everything naturally as it should be. But with the changing of environment and levels of stress and all many other things, it means even a child needs proper proper taking care of and supplementation. Like now, if today you walk to our hospitals, 58% of total pediatric admissions, those children who are admitted in hospitals, you will realize that 58% of them are calcium-related issues.
When they're young?
The mother didn't have enough calcium, the child didn't get enough calcium.
Or maybe the mother did
didn't
not
have
even
the calcium,
breastfeed the baby.
even if they are breastfeeding. It is from birth.
Oh.
From birth, the child is born without proper calcium. Okay, the mother didn't have the calcium, the child didn't get the calcium. You see? So you end up having children who have complication because of simply calcium. So I always advise, if the child is 6 months plus and can be able to take a supplement, whether it's a calcium supplement or whatever it is, but you should supplement continuously in your lifetime.
But someone, Dr. Anyway, my bad,
Yes.
told me that if you take calcium, more excess calcium, you'll also have complications.
Yeah, of course, it even leads to ulcers and what have you. That is why you need somebody, you to work with your physician so that they can be able to tell you calcium and what. Like
So
now
you
in children,
just...
you give them calcium and immunoglobulin. That is calcium and IgA. You see, that one will help the child.
So you don't just walk into a pharmacy and buy the calcium?
No, you don't do that.
Then I think there's something wrong with our laws, because I know, like in the US, I also lived there.
Yes.
You can never walk and buy medication, serious medication over the counter. Someone has to prescribe.
Yes, yes. Like now, you see, like now in our case here, people prefer doing the cheaper route. All the way, they want to do things that they feel they are comfortable with more than follow instructions. That is what is very natural for them. But now, you see, if you don't supplement your child with calcium and omegas, omega-3, omega-6, omega-9, if you don't give this child these two, then the child will be disadvantaged. Gone are the days when fish was available everywhere. You know, sometimes back when we were growing up, maybe even some
Is it
even
why
today.
we used to give, even as we used to give children emulsion?
Yes.
And cod liver oil?
Yeah.
Oh, okay.
And the 7 C's.
Yeah.
Very important. It is to make sure that their immune system is strong enough to combat the environmental diseases, infections, all that.
So, Dr. now I'll give you an opportunity to talk to Kenyans.
Yes.
Now that it's good to go out and come back with information.
Sure.
Because actually our show is about giving information, educating, and inspiring Kenyans. And when I came across you, Dr. Mongai, I was very impressed by your work.
Thank you.
And I thought it is important to share with my fellow Kenyans,
Yes.
and especially the older persons. And this information, viewers, it could be for you or for someone you know. So when you get it, don't just ignore it, share. It might help somebody. Talk to Kenyans and advise them on
Thank you very much.
Yes.
One thing that I always advise is don't take your health for granted. Your health is your personal responsibility, and never underestimate the possibility of a disease coming. Most people think that other people can be sick apart from you, but you go to a hospital and you find a newly diagnosed cancer patient and the shock in their face tells you, you better take care. You better know about yourself. It is your personal responsibility to, number one, supplement. Number two, it is your personal responsibility to know your medical history and also your family history. If you are predisposed to a given kind of a disease, like maybe diabetes, cancers and ABCD, those that you know have happened in your family, don't take it for granted. Always know you can be predisposed courtesy of the gene and the environment. So Why my advice is always know. You should always detoxify. You should always look for what you don't have, like calcium. You should do hormonal balancing, especially for women. And most important, you should be able to go to a physician and ask, what should I be doing in order to be taking care of my health, or to be in charge of this, to be in charge of my health. You look at breast cancer, for example, the rate at which it's taking our women is on another note. It's very high. More than 200 women die because of breast cancer. And the reason is very simple. They don't know their breast. They are not friends with their breast until they have some pain. Taking your responsibility of your health is of paramount importance. Deworming is also one of the things that you should have a calendar for. You should also know how to make sure that your children are well taken care of with omegas. As for the older people, just know that their major problem is not even the disease. Their major problem is the inability to digest what they eat and loneliness, because we are living in a society where older people are on their own, and this loneliness is also another cause of immune dysfunction or immune disorders. So it is up to us to know how to accommodate the older people, how to supplement them so that we can increase their quality of life.
Did you want to illustrate something before?
We could just see.
I thought you wanted to illustrate as we wind up.
I wanted to show you just how these joints are, so that you can see before maybe we wind up. You can now see on the far right, you can see that is a healthy joint. And
this one?
Yes, that is a healthy joint. That is how it should be. The cartridges, the synovial fluid, and the bones are healthy. But if you come to the second...
what is this, the blue?
That is the cartridge.
Oh,
Yes. And the other is the synovial fluid. This is synovial fluid. These are bones. That is just an illustration. That is how a healthy bone should be. But if you look at this, that is osteoarthritis, a degenerative disorder due to lack of enough minerals like calcium, magnesium. That is how the calcium degenerates. Now, this is somebody in great pain. This is somebody in great pain because the bones could be rubbing against one another.
Oh, this gap is already gone.
The gap is gone. This could be causing the patient a lot of pain and a lot of cold, change of temperature. They feel a lot of cold when they have osteoarthritis because they have lost what we call bone mass.
On their legs?
Yes, this can be the leg, it can be the hands, but now this is a knee. Now, if you look at this, this is now rheumatoid arthritis. And now this one is an autoimmune disease whereby now the immune system have attacked the cartridge.
Wow.
And now you can see the swelling, the deformation, okay? Now, this is common because you will see somebody who have changed their hands, their legs have changed, the swellings everywhere on the joints, a lot of pain and discomfort, you know. And these are the most common kinds of arthritis, and we call them metabolic syndromes. These are things that can be prevented or can be, maybe can be treated if you have enough of supplementation.
Thank you, Daktari. So can this one be restored?
Yeah, it can.
Can this knee be normal like this?
Yeah, it can. The body has a second chance, always. Restoration is always a process in the body. The body is very forgiving if given what it requires.
Wow. Wow.
Yes.
Thank you so much for your time.
Yeah.
Dr. Mungai, if someone was like interested in more information and more like you have a lot of information but time is short.
Sure.
I know you are very busy actually. We found you leaving the office.
Yes.
Where would we find you?
Right now I'm at JQuat Towers, Kenyatta Avenue, Nairobi CBD, 6th floor. It is Kenyatta Avenue, JQuat Towers, former ICA building, floor number 6, opposite AAR Hospital. You just come there, you'll find my name tag, Dr. Mungai Peter, and that is where you can find me. You can also reach me through my number, and my number is 0726 23 59 59. 0726 235959. Always remember, your health is your responsibility, and self-prescription and diagnosis have killed more people than you can imagine. So if you have a health challenge, go to a qualified physician or medic who will professionally evaluate the situation and advise. Thank you so much.
Thank you so much, Dr. Mungai. We are looking forward to having another conversation with you. This was very interesting, very educative, and definitely it has inspired me that you could become a surgeon and go back to school again. So it's never too late to practice what you think could help human beings in general.
Yes.
And we are so lucky to have you in Kenya.
Thank you.
And we hope our viewers have benefited or will benefit from this conversation and the future generation, conversations. So thank you so much, viewers. If you have not subscribed to our YouTube channel, please do so that you do not miss this very vital information. With that, we usually have an hashtag that we say, sisi zote tuungane tutunze wakongwe.
Yes.
Sisi zote tuungane tutunze wakongwe. Thank you, Doctor.
Thank you so much.
Okay.